Hello, my name's John Mendoza. I'm Director of ConNetica Consulting. I want to look at one of the issues with you today that's, if you like, dominating a lot of the argy-bargy in the federal election campaign. That's the issue of inequality and how it relates specifically to mental health and suicide. Australia is at the moment in what I would describe as a high point in the number of suicides, the number of people presenting to our hospitals, our EDs, with intentional self-harm. And that should be of great concern to every Australian. This is an entirely preventable cause of death, and yet it's got to the point where suicide is responsible for more years of life lost than any other single cause of disease or disability. It's the largest single killer of men and women under the age of 44. And I think this should be of great concern, as I say, to all Australians. So what's happening? Why are we experiencing such a high level of suicide? In fact, when we look back over the last 100 years of data, we see that spikes in suicide rates across Australia have generally been associated with periods of significant economic decline. That is, where we've gone into a severe recession or indeed the Great Depression back in the 1930s. This seems to be a little different because we are certainly not, as we're hearing from our political leaders, in a recession. Indeed, we're constantly told how strong the Australian economy is. But it really goes to the issue that ConNetica, with our partners at the Centre for Mental Health Research at the ANU, the Australian National University, and also partners at the University of Sydney Brain and Mind Centre. Last 4 years, we've been looking at lots of regions across Australia. In fact, about 40% of the Australian landmass. So hundreds of local government areas that we've looked at. And we've been looking at what are those factors that are common in these areas that also then lead to higher rates of suicide and self-harm. So we look at things like the rates of employment, the level of income that each family and household has, the educational attainment of people in that community. So how many people have finished at least year 10 education as one indicator of education outcomes, the number of people needing assistance in the home, single parent families. All of these are factors which we know are associated with higher rates of suicide, self-harm and mental illness. So what we've found is that those communities where we see, if you like, a constellation, a number of these factors recorded as higher, we see that the levels of psychological distress that population, that community experiences is higher. We also see that in many other cases the numbers of suicides in those localities, in those local government areas, are higher. And we see the number of presentations to ED and our emergency hospital for services, our acute mental health care facilities, are higher. So it clearly establishes, as has been established in other parts of the world, the very strong links between inequity in our community and high rates of suicide, higher rates of self-harm, higher rates of many common mental health conditions, anxiety, depression, alcohol and drug dependence, and abuse being the three most prominent ones. So what have we got to do to change this? Is it about putting in place more services? Of course, people with any health condition deserve access to quality care, affordable care. We've got to make sure that services are accessible, are affordable and are effective. No question about that. But we've also got to look at what are the drivers of this despair, and can we as a community, if you like, lower the pressure on these vulnerable communities and lower the numbers of suicides, incidents of self-harm, presentations to hospitals and EDs of mental health problems. And unless we tackle those determinants of mental health, if you like, the social and economic, environmental determinants of mental health, we will never be able to fund enough services. And I think that's a great challenge for the Australian community as we go into this election campaign. Understand the policies of all of the major parties and the leaders and what they're talking about, and ask yourself, is this going to lower these pressures on vulnerable communities, or is it going to exacerbate it? The most unequal societies in the world have the highest rates of suicide, self-harm and presentations of problems at hospitals. Those more equal societies have less of these things. So if you want to learn more about this, visit our website at www.connetica.com.au. Look for today's blog, Social Determinants of Mental Health and Inequality. And obviously, in the run-up to this election, consider the policies of the major parties and examine them from this perspective. Thanks for joining us.